The cost of dental implants. We even get lots of questions about how much are they. So what affects the cost?
Well, I have a sheet here, and I don't want to leave anything out, but one of the biggest things that influence the cost is the implant cost. So in our office, we use high-quality implants. These implants cost about $300 a piece, and they are this gold standard. They are the implants that should be placed most of the time because they're the most well-studied, and they are the gold standard for teeth that are supported by dental implants that don't come in and out. The next big thing that comes up is how many doctors are involved. Lots of offices, they will refer to other doctors, sometimes 2 or 3 other doctors that will be providing the service. So that is going to increase the cost exponentially.
So they go to one doctor that does the surgery, is that correct?
Yep.
And then another doctor that puts the teeth.
Mm-hmm.
And what? What else?
And then sometimes there's even a third that they're going to go back to maintain the teeth.
Okay.
So in our office, we do the surgery, we do the teeth and installation and design, and then we also maintain in our hygiene department.
So one doctor, one fee.
One doctor, one fee.
Okay.
So that saves lots of money for our patients. The next thing that affects the cost is the amount of surgery that's needed.
Okay.
Some guys are breaking up the surgeries into the removal of the teeth, doing bone grafting, referring to this doctor or the other, and that can influence the cost quite a bit. In my office, I rarely have much more than just one surgery to do this procedure.
Okay.
After that is the big lab bill. So oftentimes, doctors are sending these cases out to labs that have huge fees, which are then sent right back to the patient.
You used to do it that way.
I used to do it this way, and I realized that I was not doing a service to my patients by doing it this way. And what I did is that I took the time to learn how to make and design and manufacture the teeth all in my office with a team around me that is specially trained to do these things well and consistently, which significantly cuts down on that lab bill.
Very nice.
Saving our patients money. The next big thing is insurance coverage.
Yeah, what does insurance cover?
So insurance, a very good insurance plan will cover you anywhere from $1,500 to $2,000 in dental treatment every year. And oftentimes this is only preventative dental treatment. It's not covering implants or surgery and the things that we need to do for this procedure. And it's not covered by Medicaid, Medicare, unfortunately, for patients that might be seeking that out. And with that being said, most patients are having to finance this treatment. About 90% of my patients that end up doing this, yes, they treat it like a car payment, and they end up financing it, and it ends up working out for everybody.
So you have people in your office that help them get financed through outside lenders, is that correct?
Yes, we use an outside lender, but we do handle everything in the office, so patients aren't having to navigate this process by themselves.
Okay.
The sixth thing that influences this a lot is the materials. And when I say materials, I'm talking about the material the teeth are made of. So there's different materials out there. It could be acrylic, it could be plastics, it could be, some people call it PMMA, and these materials aren't nearly as nice as what we use, which is zirconia. Zirconia is very beautiful. It looks very natural.
Is that the gold standard in dentistry right now?
This is the gold standard in dentistry, and it allows for the strongest result in the teeth that are made, so they don't break, and they are beautiful as well.
Okay.
The next thing that influences the cost is the warranty, and we stand behind all of our work, and if there is problems that arise, we will navigate them with you and make sure we get them solved.
Okay.
The next thing is snap-in, snap-out teeth. And what I mean by this is that many people think when they get snap-in, snap-out teeth that they are getting fixed teeth that don't come out. And this service costs significantly less than the teeth that are held in by dental implants and are not removable for many different reasons. But these are...
So it's like a snap-in denture.
This is a snap-in denture.
You say patients don't like those.
They move, they rock. They are not like natural teeth by any means, and most patients that get this done end up going to the teeth that are held in permanently by dental implants.
Okay.
The last thing, which is probably the most important, is the doctor's experience and training. So you want to go and see a doctor that has been doing this for a long time and knows how to get consistent results and knows how to navigate the challenges that will inevitably arise when you're doing this treatment. And that's probably the most important thing that influences cost, is the training and expertise of the provider. That's why when people call and they ask the cost of dental implants, that we tell them it's not that simple. We just ask that you come in to see us, and we will give you a treatment plan in writing so you know the cost for this treatment beginning to end, all inclusive.
I'll put you on the spot. There are the bigger companies, or you see them a lot on TV. Are you less than these implant centers?
We are less than them, and we're aware of that. And we're happy to cater to the patients that might not be in a position to pay the bigger fees.